My name is Dr. Thomas Schuler. I'm chairman of the Medical and Scientific Board of the National Spine Health Foundation.
Hi, I'm Tao Allen. I'm a fellowship-trained physician assistant.
What we really need people to understand is when they have low back pain, how do you start the treatment? So Tao, people come into you, they want to see you for the first time, you got low back pain. How do you start? What do you do with them, and where do you take it?
Sure. As a spinal specialist, it's important for us, and it's our responsibility to make sure that the patient doesn't have anything bad, cancer, tumor, a broken bone or inflammation. So it's important for us to do a quality physical exam and evaluate the patient, and also get updated imaging studies if they need any. That can be x-rays, and if the patient is indicated, sometimes it can be an MRI, a nerve conduction test to understand if there's any nerve damage, or special scans to rule out cancer or inflammation in the bone. And so those are really important tools that we have to help evaluate the patient. But the key things as far as for most patients to understand or address their back pain is to educate the patient in the quality non-operative treatment that they have. And that's in the physical therapy and understanding the importance of core strengthening and joint mobilization, and also an aerobic exercise program to understand the importance of fitness to offload the stress on their back and on their discs.
Yeah. No, I think it's critical to understand that rarely do people have cancer. So that's the exception. And most people, they just have a problem where tissues aren't moving right, or they have a little degeneration, or they're pinching a nerve. And so there are so many things we can do without surgery to get them better, and that's the good news. In fact, over 90% of the patients make marked improvement and make a recovery completely without surgery. So it's rare that people need surgery, even coming to a surgeon. So this is a surgeon's perspective that rarely do we have to operate on people, and rarely, less than 1-2% of the time would people have something serious such as cancer or something else that we would need to address on an emergent basis. But I think it's important to understand that every competent PA surgeon who looks at a patient, we always have to have that question in the back of our mind, is there something bad going on? But fortunately, that's rarely the problem. And so I think that really understanding how to get people going, moving in the right rehab program, which comes down to quality physical therapy. And not all physical therapy is equal, and it's important that people become part of the process. You'll never get rid of your back pain if you're not contributing to getting better. What that means is working with a program to strengthen your muscles and to mobilize, work on flexibility, stretching, all those things to help. And that takes care of most people. The vast majority, over 50% of the people, are markedly better just because they need a little education and they need to be moving. Hot packs, ultrasound, doing the passive things feels good, but it doesn't solve the problem. You need to be doing a dynamic process to get better. And that's, I think, the critical thing about quality therapy, which is the essential part of getting better. And then using anti-inflammatories, as you said, Advil, Aleve, Motrin, things like those, or a prescription strength of those, can be very beneficial if people can tolerate those to help get over the hump. Then if that doesn't work, that's where we come back and say, maybe you need an injection and the other diagnostic tests. So we start with an x-ray, but you get an MRI so we can look inside the spine and see the nerves, see the discs, see if something's going on. EMG is something called an electromyogram, or EMG, and that's where we put little electrodes on an extremity, either on the arm or in the leg, to see if a nerve's functioning properly. By using these tests, we can pinpoint where the problem is, if there's a problem where somebody's losing nerve function. And these are common tests we do to understand what's going on. And there's other tests we can do, but they're much more decision-making about what else to do or where to go from there. People have fear of the unknown, fear of what their future is. Can they get back to their lives? And it's really giving them a competent medical reassurance that this is nothing dangerous, and that with the right treatment, we should be able to get your life back. Unfortunately, that's what happens most of the time. But it's a question of having people get the right treatment, make sure they're doing the right program to get better, and then quarterbacking them through that, following them along and helping coach them so that they can overcome their problems and get their lives back. And that's what spinal specialists and spinal PAs, that's what we do.